had 21 doses, so that was great. Second clinic, we had only 9 people register, so the kind of demand is less, and that's why we didn't do it for a couple of weeks. At this point, I'm just waiting for them to authorize the second booster for everybody, and then we're gonna do more clinics. I do have vaccine in hand, so just waiting for the FDA, CDC to clear second booster for all, or we are just keeping a spreadsheet. If demand is going to come, we will conduct more clinics at this point. With the monkeypox, the cases are kind of rising. As of this morning, we have 265 cases in Massachusetts, and total number of US cases at this point is 15,433. So keeping an eye on that. With the arbovirus update, because there is nothing with triple E this year. We have 0 of human cases, 0 of animal cases, 0 of water samples, that the mosquito samples. With the West Nile virus, we don't have any human or animal cases, but we have 41 positive water samples so far. And one reason I think, and this is just my thinking, with nothing in the states, and it's a very good news, right, that we have not seen a single case of either West Nile or triple E, is the drought conditions. So mosquitoes don't have too much water there to survive. So that's the only good news with the drought. So
yes, agreed.
We don't have any mosquito-borne disease so far. With the beach reports, at this point, all of our 3 water bodies, Ashland Reservoir or the Hopkinton Main Beach and the Upper Beach are all open. They was kind of closed for most of the season, especially the Hopkinton ones. One reason I think is the drastic changes in the weather. Like hot weather, cold weather. Kind of that's what keeping the bacterial count up. But now all 3 of our water bodies are swimmable. They are open. Childhood vaccine program, we are doing great with that. Even we are getting calls from outside our Metro West shared services region. There are a couple of communities have reached out to us, but we are not opening outside the 8 communities because we don't have resources right now, the manpower, but eventually, hopefully, we'll open that to other communities as well that are outside our region. We're gonna be busy with the vaccine clinic because the Framingham nurse Kitty Mahoney have retired. So that clinic have closed right now. So I guess ours is the only one in the region that's open, and there are gonna be a lot of kids coming from Framingham. We are in touch with them. We're gonna be getting their kids as well, for this season. So that's gonna keep us busy.
Yeah. I mean, we probably owe them anyway, Raj, huh? For all the years
no,
they
sir.
helped us out.
I definitely, I guess, from the last maybe 25, 30 years.
Yeah, exactly.
But it's time to pay back, man.
Yes,
and I'm glad, that whatever we can offer to them, we are here, So we did get a good amount of vaccine transfer from them. They had a huge stockpile, so we did get some vaccine also from them. That got transferred to us.
Yeah, that's great. Yeah.
Thank you. Yeah. With the well that the board approved in the emergency meeting at 10 Saddle Hill Lane, it's not finished yet. The owner was here today. They are having some challenges, with the new well as well. So it seems they did find some water at a good depth, like 500 feet, but then they dig it up to 1,000 feet, so they're kind of still working on the well. The only thing is like they have only till Saturday from the Conservation Commission, because their emergency authorization was valid only for 30 days. So we are working with them. Hopefully they'll be able to finish the work before that, and I'll keep the board posted, so.
Okay.
The last item, decision at every turn. They have a retreat on October 14th from 8:30 to 11 a.m. I know, Dr. Ron, you are one of the liaisons, and Diane was also a liaison on decision at every turn, I get now at this point, if any of the other board members, they want to be a liaison at the decision at every turn, we will appreciate that, So I'll open that to the board, if somebody
Raj, what day is that? Is that on I'm trying to pull up my calendar. It's not coming up. What day of the week is that? Is it a weekend or?
Right. So right now, 14th, it's a Friday.
It's a Friday. Yeah. It's probably not. Yeah. That's going to be difficult for me to get there. I can see if I can make it. I do love that organization, so I certainly wouldn't mind unless anybody else has an opportunity to go. But we can. I would at least review that next time.
Can you tell us a little bit about the organization?
Yeah, I'm sorry.
Can you tell us a little bit about the organization, the DAET?
Yeah, so it's why am I going to forget her name now? And I can see it. It's headed up by Kristen French.
Yeah,
There's a grant from this. Go ahead, Laura. You probably do a better job.
Oh, no, you go ahead. You've attended. You've been a liaison for quite a few years.
It's basically it's a few community members. Jay's wife was big in helping to institute it and was on the board for many years. And it's hopefully designed to be a collaboration between some adults and a lot of students to help prevent kids from making bad choices, including smoking, drugs, alcohol. And they have brought a lot to the community, and they are really, in my opinion, an invaluable arm of the Board of Health that doesn't cost us anything, but has a great mission statement to help keep kids safe and trying to make the right choices and keep them from getting into trouble, and developing bad habits. And they do a lot of work. There's outreach programs. Everybody is obviously always welcome to go to their meetings. Not a ton of people did. They were maybe once a month. Usually they're at the middle school. Obviously that hasn't been the case since we started. I really do applaud them for all that they do. I think I don't know any other town that specifically has it. They probably do, but I don't know any other town. Jay, what do you know at least as much about I do? Can you add anything?
Yeah, I mean, I've been sort of, since Liz left Decisions, which was a few years back, I've been kind of out of the loop. But yeah, initially, it started out as a group that was interested in just as Ron said, really substance use and helping educate the community, especially kids, in making good choices related to substances and not just drugs and alcohol, but also nicotine and that sort of thing. They got, and I forget what year it was, but they got a state, or maybe it was a federal grant, to fund some staff. And at that point, it just kind of grew, and I don't know when you came on board, Ron, but
she was still there. She was there for at least the first couple of years.
She was there for the first couple of years. She worked with Amy. They together were involved in writing for that grant. And she was a chair for a few years. But I think that she's been off it maybe for 4 years or something like that at this point, or it could be longer. So I haven't really kept track of it. Until I got back to this Board of Health, I really haven't been involved, and she hasn't been. And related to this retreat, just getting back to that, I unfortunately wouldn't be able to do a Friday like that. And it sounds like, Raj, you are saying that you're looking for a liaison just for that retreat, or are you looking for a Board of Health liaison?
No, it's going to be a Board of Health liaison, sir. But I mean, if one person can attend it, that's great. I'm gonna be there, you know.
But you mean just for that day you're talking about, or
no,
a
but
liaison?
this is recommend, you know, like if you whichever board member can join, you know. So I guess it's two liaisons from Board of Health, you know, and because Diane is not on Board of Health anymore, you know, so we need one more member, you know.
Yeah.
Got it.
Well, gonna take place?
I don't mind continuing to do it. Interestingly enough, it seems like a lot of their meetings fall on the same time as our meetings. So sometimes there's a conflict, and obviously our first, you know, duty is to this board. But you know, maybe that's something that, you know, that I can talk to Kristen about, because I really like that whole group. I don't think that I added anything, but it's nice to sit in on, you know, what they do. And, you know, they do these norm surveys, which I think are, you know, incredibly valuable. You know, they actually get information from, you know, from the kids, and it's you know, some of it's eye-opening. I'm still shocked that the numbers that they bring up with kids that have in middle school, or even kids in grade school that have, you know, tried smoking already, and, you know, vaping, even though it's a small percentage. It's really amazing what they do. So, yeah, I wouldn't be able to make that, but I'm still happy to be a liaison. It's just if there's a conflict, you know, between our meetings, which it seems like there is relatively regularly, that just makes it difficult for us.
I'll reach out to Raj in regard to that and see if I can join.
Yeah, it is really a nice group. You do get a chance to, you know, learn a little bit more about it, and, you know, I'd be happy to continue to do it as well.
Okay.
Yes, Dr. Ron, I guess we love you to be there anyways, but if one more board member, and we can table this again next time, you know, I guess.
Okay.
We have some time
let's review it again, and you know, maybe I'll try to reach out to Kristen. Maybe she can you know, come and give a little talk. She has done that occasionally in the past, and, you know, maybe I can just review with her the dates for their meetings. I don't expect them to change everything around for us, but you know, I'll review that with her. So,
wonderful.
Okay.
Thank you.
Great. Okay, great. All right. Thanks, Raj.
That's all I have. You know, I'm open for any questions. If anybody have any questions for me, please.
Raj, I do. Did you want to follow up on the situation that you had sent out an email about that? I'm just trying to dig it up right now with the Housing Authority, just to update.
Yes, sir. So I did consult last meeting. You know, we have 41 Park Road Unit D. You know, the housing case at the Ashland Housing Authority. You know.
Oh, did you? If you already did this at the meeting I wasn't at, I'm sorry.
No, absolutely. So
okay.
It was at the meeting. We had just some clarification to be, you know, we did get some clarification from our counsel, you know, Lisa Mead, you know, about the case, and I have forwarded that email to the board. You know, at this point, she's saying that the Housing Authority Board have more jurisdiction over the case than the state sanitary code, you know, so they have taken that decision because of the safety issue. They are not replacing the stove in the unit. So according to our counsel, they have authority to do that, you know, so we kind of will see where we go, but this is where we are right now with the case, you know, so.
Yeah.
So that, as far as you know, that still has not been installed or reinstalled in the apartment?
That is correct, sir. I have no communication from the Housing Authority, and the email from the council, I have sent it to the board, you know.
Okay.
And if we have any other information on that, I'll keep the board posted.
Okay.
Dr. J, anything else?
No, that was it. And I did get that email, Raj. Thanks. I'm just wondering if there was anything since then, but thanks.
I still have your marathon pullover, you know, when I was.
Yeah, sorry.
Yeah.
Yeah. Yeah, things have been crazy. I was on vacation. We were bringing our daughter to school and all that. I'm gonna get over there because.
All right, I'll
Well, that's
come
good.
by one of these days, you know, so yeah. Thank
Okay.
you.
Yeah,
Thanks.
thank you.
Okay, and since unfortunately we still are not all together, we'll table the reorganization of the board till next time. So we got a lot of tabled things, Laura. So we already have kind of like a half full agenda, huh?
Right.
Okay. You can kind of just copy this one, I guess. And
Okay.
then getting on to 9, I guess we're, back to our usual. So it should be the first Tuesday, which I'm guessing is late this year, right? No, it's the 6th. So I'm assuming, we'll be able to have that meeting.
Yeah.
Yep. Okay.
6th and the
Anything
20th.
else? Yeah, the 6th and the 20th. Unless a lot of people can't make that.
Works for me.
Yep. Okay. All right. Anybody have anything else? No. All right. Anybody for the most important motion of the night?
I guess I'll make it.
Okay.
Make a motion to adjourn.
Okay. Any seconds?
I'll second it.
Okay. Thanks, Barbara. All right. All in favor?
Aye.
Aye.
Okay.
Okay.
Hi, Barbara.
All right, everybody have a good rest of the summer, and I'll see everybody, we'll see everybody on the 6th.
All right.
Sorry for the technical
right.
difficulties.
Thank
All right.
you.
Thanks, Laura. You're awesome as usual. Thanks, Raj.
Thank you, sir.
All right.
Thank you.
All right.
Thanks,
Have a
Paul.
good night.
All
Thank you,
right.
everybody.
Bye.
Thank you, Bob.
Good
All
night.
right. Bye-bye.
Bye bye. Thanks.